From sleep medications that cause amnesia to painkillers that triple your heart attack, risk to diabetes drugs linked to bladder cancer. These are all the prescription drugs you and other seniors are taking right now that are literally banned in Europe. And spoiler, while some of these were pulled from European markets for causing death, in America, your doctor is still writing millions of prescriptions a year. But first, let's start with the most common one sitting in bathroom cabinets across America: Tylenol. High-dose acetaminophen, Tylenol. In Europe, you can't buy more than 500 mg of acetaminophen per pill, and pharmacies won't sell you more than 32 pills without a prescription. The UK limits you to 2 packs at checkout because they're trying to prevent liver damage and overdoses. In America, you can walk into CVS and buy 500 tablets of extra-strength Tylenol. That's 325,000 milliliters total. Each pill is 500 boers, and people pop them like candy for every ache and pain. The result? Acetaminophen is the leading cause of acute liver failure in the United States. About 56,000 emergency room visits per year. Because apparently unlimited access to liver-destroying medication is freedom. Pretty wild when you think about it. But if you thought that was bad, this next drug will literally make you forget entire conversations. Zolpidem High Dose, Ambien. Ambien is prescribed to millions of American seniors for insomnia. The problem? It causes next-day impairment, falls, fractures, and bizarre behaviors, like sleep driving and sleep eating with complete amnesia. In Europe, the European Medicines Agency requires much lower doses, especially for elderly patients and women, because the drug stays in their systems longer and causes dangerous next-day drowsiness. In America, doctors were prescribing 10 peaks doses like candy until 2013, when the FDA finally recommended lower doses. But here's the thing, it's still just recommended, not required. So American seniors are still getting prescribed doses that European regulators consider dangerous. One woman drove to the grocery store, bought groceries, and woke up the next morning with no memory of it. Get this guy a safer sleep aid and maybe a door alarm. And Ambien isn't the only sleep drug causing problems. Diphenhydramine high dose, Benadryl as sleep aid. Millions of American seniors take Benadryl as a sleep aid every night. The problem? It's an anticholinergic drug, which blocks neurotransmitters in your brain. In seniors, anticholinergic drugs are linked to cognitive decline, dementia, falls, confusion, and urinary retention. European guidelines strongly discourage using diphenhydramine in elderly patients. In America, you can buy 100-count bottles at any drugstore, no prescription needed, and millions of seniors take them nightly, slowly increasing their dementia risk. Because a good night's sleep now is worth forgetting your grandchildren's names later, I guess. Dang, that's sad. Now let's talk about the drug class that created an entire epidemic. Opioid painkillers. In Germany, strict guidelines limit opioid use to severe cancer pain and end-of-life care. In France, doctors face serious scrutiny for prescribing opioids long-term. The UK has tight controls. In the United States, we prescribe opioids at nearly double the rate of European countries. At the peak in 2012, American doctors wrote 255 million opioid prescriptions, enough for every adult to have their own bottle. And seniors are the most heavily prescribed demographic. About 1 in 3 Medicare beneficiaries receives an opioid prescription every year. The result? The opioid epidemic. Addiction, overdose deaths, and a healthcare system that handed out OxyContin like Halloween candy. Squad goals, big pharma. And many of these seniors are still on them. Dependent, unable to stop without brutal withdrawals. Speaking of drugs that create dependence, let's talk about something almost everyone over 70 is on. Benzodiazepines long-term use, Valium, Xanax, Ativan. Benzodiazepines, Valium, Xanax, Ativan, are supposed to be short-term solutions for anxiety and sleep, maybe a few weeks max. In Europe, prescribing guidelines strongly discourage long-term benzodiazepine use in elderly patients because they increase fall risk by 30%, cause cognitive impairment, lead to dependence, and make dementia worse. In the United States, millions of seniors have been on benzodiazepines for years, sometimes decades. About 1 in 10 seniors fills a prescription annually. These drugs are on the Beers criteria, a list of medications that should be avoided in older adults. Every geriatric specialist knows this. But doctors keep prescribing them because patients are dependent and withdrawal is dangerous. So we created an epidemic of elderly benzodiazepine addiction, and now we can't stop. Man, I hate ironic tragedies. Now let's discuss a drug that seemed like a miracle until people started dying. Avandia, rosiglitazone. Avandia was a blockbuster diabetes drug, raking in $3 billion per year for GlaxoSmithKline. The problem? It significantly increases your risk of heart attacks and heart failure. In 2010, the European Medicines Agency looked at the data and banned it across all EU countries. Germany pulled it, France pulled it, the UK pulled it. Done. In America, the FDA restricted it but didn't ban it. They put warnings on the label and made it harder to prescribe, but it's still technically available. And in 2013, the FDA actually loosened those restrictions again. So while European seniors haven't been able to touch this drug for 15 years, American doctors can still prescribe it. Your heart attack. Your choice, I guess. Speaking of heart attacks, here's a diabetes drug linked to cancer. Pioglitazone, Actos. Actos helps control blood sugar, but it also increases your risk of bladder cancer, heart failure, and bone fractures. France banned Actos in 2011 after data showed a significant bladder cancer risk. Germany restricted its use. The European Medicines Agency issued serious warnings. In the United States, the FDA put a warning label on it, but kept it on the market. And it's still one of the most prescribed diabetes medications in America. Here's the math. We're trading slightly better blood sugar control for a higher chance of cancer. I'm not crying, you're crying. Actually, I'm just angry. Now let's talk about drugs that are overprescribed to a dangerous degree. Fluoroquinolones, Cipro, Levaquin. Fluoroquinolones, like Cipro and Levaquin, are powerful antibiotics that can save lives. They're also incredibly overprescribed in America for minor infections that could be treated with safer antibiotics. The problem? They cause tendon ruptures, nerve damage, psychiatric effects, and aortic aneurysms, especially in seniors. In Europe, prescribing guidelines are strict. These drugs are reserved for serious infections where other antibiotics won't work. The European Medicines Agency issued strong warnings restricting their use. In America, doctors prescribe fluoroquinolones for urinary tract infections, sinus infections, bronchitis, conditions that could be treated with safer antibiotics like amoxicillin. About 23 million prescriptions are written annually in the U.S., and the side effects can be permanent. People's Achilles tendons rupture while walking to the mailbox, or they develop permanent nerve pain, all because their doctor prescribed the nuclear option for a simple UTI. Get this guy a basic antibiotic and a better doctor. Speaking of overprescribed drugs, let's talk about stomach acid reducers. Proton pump inhibitors, PPIs. Long-term high dose, Prilosec, Nexium. Proton pump inhibitors, like Prilosec and Nexium, reduce stomach acid. They're great for short-term use for ulcers or severe acid reflux. The problem? In America, millions of seniors have been on PPIs for years or decades, often at high doses. In Europe, guidelines strongly recommend using the lowest effective dose for the shortest time possible because long-term PPI use is linked to bone fractures, kidney disease, dementia, pneumonia, and serious intestinal infections. In the United States, PPIs are available over the counter in high doses, and doctors prescribe them like candy. Many seniors are on them indefinitely without anyone questioning whether they still need them. Studies show that about 70% of PPI prescriptions in nursing homes are inappropriate, meaning the patient doesn't actually need them. The result? Seniors with osteoporosis break bones because their bodies can't absorb calcium. Seniors developing kidney disease, all because we're suppressing stomach acid that they actually need. Now here's something that affects your pain and your wallet. Aspirin Plus. NSAIDs. Combination, millions of American seniors take daily aspirin to prevent heart attacks. Millions also take NSAIDs like ibuprofen or Aleve for arthritis pain. Taking them together significantly increases the risk of gastrointestinal bleeding and ulcers. In Europe, there are strong warnings against combining these medications, and doctors actively counsel patients to avoid it. In America, both are available over the counter, and many seniors have no idea they shouldn't take them together. Nobody tells them. The result? About 16,500 deaths per year from NSAID-related gastrointestinal bleeding. Many are seniors who are just trying to manage arthritis pain while preventing heart attacks. Pretty crazy that a trip to CVS can accidentally create a lethal drug interaction. Speaking of dangerous combinations, here's a muscle relaxant that shouldn't be anywhere near seniors. Muscle relaxants, Flexeril Soma. Muscle relaxants like Flexeril and Soma are prescribed for muscle spasms and back pain. In Europe, these are either heavily restricted in elderly patients or outright avoided. They cause severe drowsiness, confusion, falls, and have anticholinergic effects that worsen dementia. In America, they're on the Beers criteria as drugs to avoid in seniors. Every geriatric expert knows they're dangerous. And yet, they're still prescribed constantly. Why? Because an 80-year-old comes in with back pain, the doctor prescribes a muscle relaxant, and the patient falls, breaks a hip, and ends up in a nursing home. There's literally no good evidence that muscle relaxants work better than Tylenol for most back pain. It's like we're trying to create hip fractures. And finally, let's talk about the most disturbing entry on this list. Antipsychotics for dementia, off-label. Antipsychotic drugs like Risperdal and Seroquel are approved for schizophrenia and bipolar disorder. They are not approved for dementia-related agitation. In fact, they carry a black box warning that using them in elderly dementia patients increases the risk of death. In Europe, antipsychotic use in dementia patients is heavily restricted and closely monitored. It's considered a last resort when nothing else works. In America, about 1 in 4 nursing home residents with dementia receives antipsychotic medications. Many are given these drugs because they're difficult, meaning they wander, they're confused, they're agitated. Instead of addressing the underlying causes, we chemically sedate elderly dementia patients with drugs that increase their risk of death by 60–70%. The FDA has repeatedly warned against this practice, and yet it continues because understaffed nursing homes find it easier to drug patients than to actually care for them. I'm not crying, you're crying. Actually, we should all be crying because this is horrific. So here's the reality. Europe bans or restricts drugs based on safety data. America keeps them on the market with warning labels and hopes doctors read the fine print. The result? American seniors are taking medications for sleep, pain, diabetes, and anxiety that European regulators have determined are too dangerous. And pharmaceutical companies are making billions while patients deal with heart attacks, falls, bleeding, dementia, and addiction. But that takes us to today, where the average American senior takes 4 to 5 prescription medications daily, many of which wouldn't be allowed in Europe, where direct-to-consumer advertising convinces people to ask your doctor about drugs they don't need, where profit matters more than safety. And here's the thing. It's not that European regulators are perfect. It's that they prioritize safety over access and profit. They pull drugs when evidence shows harm. Maybe we should ask ourselves, if a drug is too dangerous for Europeans, why is it fine for Americans? Revolutionary concept, right?